This is part 2 of pain referral patterns. So in part 1, we talked about all the referral patterns of the upper body that we see clinically. Now there's a few other ones included, but for detail's sake, we didn't go into them. This time we're going to talk about the lower body referral patterns. There's actually a lot more in the lower body, so bear with me. But these are extremely important because this is another area where we see that clinicians are missing the diagnostic piece and patients aren't getting the care that they need. So as we've spoken about this before, pain referral patterns don't move up the body, they move down the body. So in this case, we're going to start at the pelvis, all right? So obviously you have low back pain, but the first place that pain can move down from or down to is the pelvis itself. So where people will experience this pain is usually down here into this area. Usually it's all back-sided, or they'll feel like there's pain or discomfort in their like back dimple region. Pelvic pain is usually coming from the TL junction. So what that is that's an area that is higher up in the low back. So if you would call this your lower back, it's just a little bit higher, okay? That pain will shoot down and refer directly into that spot, okay? Your low back can also refer pain to the pelvis. Your glute can refer pain to the pelvis, and then also trigger points in your low back and in the glute itself can refer pain into that same spot. So you can see why this is a little complex to diagnose and figure out where it's coming from. There's a whole other section of this called pelvic floor pain, which those are some of the deeper muscles, but we're not going to get into that because that's just not our area. The next common referral pain that we focus on or that we see clinically is the hip. So where people experience this type of pain is in the side of the hip and then down into the groin, right in that area. Pain referred to that region can come from that TL junction, so again, that upper part of the low back, your low back itself, the glutes, the hip joint, a tendon in the hip, and then also trigger points. So again, the further away we get from the center of our spine, the more tricky diagnostics become because people will start working on a lot of these areas where the pain is, but it's not coming from there. Then we go to the knee, it gets even more sticky because knee pain can also come from your back. That pain can be lateral if it's coming from your back, or it can be in the back of the knee. Usually if the pain is in the front, then the pain is usually coming from a ligament, a tendon, the knee joint itself, cartilage within the knee, or it could be coming from a trigger point referral again. So it's really important based on the location of pain for diagnostics, and then also in stressing some of these areas higher up to make sure that they're not sending pain down lower. Then lastly, the foot. So again, surprise, surprise, your low back can refer pain to the foot. Also, you can have pain in your foot that's caused from a ligament, a tendon, the joint itself, or the different joints in the foot, and then the bones. So fractures are another thing that's actually a little bit more common in the foot versus other areas in our body. So these are all things that we have to keep in mind as we're evaluating a patient to diagnose the problem and treat correctly. If you're struggling with a diagnosis or you're struggling to get results and you've been seeing a provider for a while, reach out to us so that we can do a thorough evaluation, figure out exactly where the cause of the pain is coming from, and begin targeted treatment to get you the results you're looking for.